Good afternoon, and thank you so much for joining us here today. I'm Shannon Andrews, Chief Equity and Inclusion Officer here at Cook County Health, and I'm thrilled to be leading this panel of guests as we celebrate Hispanic Heritage Month. During National Hispanic Heritage Month, we recognize all of Cook County Health's Hispanic and Latino staff who work tirelessly to ensure that providing equitable healthcare services and a welcoming environment for the patients that we serve is a priority. And we are also grateful to our very diverse patient base and the community partners we work with every day who help to ensure equal access to our services across Cook County. Now, before we begin, please join me, and I am happy to welcome our Cook County Board President, Toni Preckwinkle, to share a few words.
All right, thank you, Shannon. And thank you to Israel Rocha, Dr. Ruiz, and Christine Urbina for being part of this discussion about the role of the Latine community in healthcare. Across Cook County, Hispanic and Latine residents bring cultural depth and economic stability to local communities. Among the many roles they take, they serve as government officials, business owners, community leaders, and activists, and of course, healthcare workers, improving the lives of those around them. I'm grateful for the work of Cook County Health throughout its history, more than 100 years, to ensure equal access to care. Cook County Health accomplishes this through language access, a diverse staff that promotes cultural competency in care, and a variety of programs to make sure patients of all backgrounds can get their healthcare needs met. I look forward to listening to this important discussion today as we look to the future of Cook County Health. Thank you all.
Thank you so much, Madam President, President Preckwinkle. It's always an honor to have you participate in these panel discussions with us. Now, I would like to introduce our panelists and have them say a few words about themselves. And I think it'd also be really interesting to hear from each of you why you chose to work in medicine. And with that, we are going to start with Dr. Ruiz. Dr. Ruiz, would you please introduce yourself and let us know what led you to medicine?
Yes, thank you for the invitation, Shannon. I'm Dr. Juan Pablo Ruiz. I come from Bogota, Colombia. I did my medical school there at the National University of Colombia, or Universidad Nacional de Colombia. And then I came in 2008 to do my internal medicine residency at Stroger. I did a chief residency year, and then went to do nephrology at the University of Chicago. Worked in private practice for about 3 years, but then I was invited back to start the peritoneal dialysis program in 2017, and have been working in that program and in many other things since then. So very happy to be back at County and working at kind of my alma mater from Chicago. So why I went into medicine, I think, well, there was a lot of interest, science part, a lot of variety, research, many things, clinical work, but also it has a huge social component that I'm also very drawn to. And so to me, it was always kind of a passion to be able to serve in that way. So that's what I keep doing and want to keep doing for a while. So that's it, basically. Thank you.
Thank you. And we are, of course, happy to have you back. With that, I'm going to move on and have Christina Urbina introduce herself to the audience.
Hi, good afternoon. Thank you, Shannon. I'm happy to be on a panel with the both of you, Dr. Ruiz. Again, Christina Urbina. I am the Service Business Line Director, Cook County Health. That's a long title to mean that just really oversee access, patient satisfaction, quality, partnerships for women and children's health across our system, outpatient and inpatient, and supportive programs to support healthy families. I am from Michigan, so I'm a transplant to Illinois, but I have been working, my background that led me into healthcare is both a professional and personal interest. I have family members that really needed, support and access to healthcare just due to complex needs, language needs. I have my own personal journey and story that led me to do the work that I do to support women and children. in access to quality healthcare and equitable healthcare. I've worked in the FQHC world and wanting to really make an impact for our Chicagoland communities to really work and develop a good system that provides that equitable access to care for all communities to build healthy lives. So personal and professional mission to serve the communities, especially women and children, is really what led me here. So happy to be with you and to have this discussion to share the good work that we do here.
Thank you both so much. So we're gonna jump right into it, and I think I'm gonna pose the first question to both you, Dr. Ruiz and Christina. From the clinical side, can you talk a bit about why culturally competent care is so important and what that looks like in the healthcare space, in the clinics, and where we provide service? And why don't we get started? We'll jumpstart with Dr. Ruiz. Would you mind jumping off on that?
Sure. Well, I mean, there's clear correlation between improved adherence and to treatments in patients who have physicians that are, or clinicians that are able to speak their own language, that are culturally empathetic, and that understand where they come from. So, especially in renal or in nephrology, there is a lot of things that are very scary for patients, many changes in their lives that are huge, and that if you don't understand their background, that can cause a lot of disruption and fear. And so a patient whose kidneys fail, they need to go on dialysis. If we want to prevent that from happening from early stages, we need to make a lot of changes in diet, a lot of changes in their routine. And so when we're able to speak their own language, they are able to understand why we're doing this. Many times we give patients recommendations in diet that in a different country might be very difficult to achieve, or if we tell them to cut on certain things, which are the main reason why a main meal that they're having, then it could be just very, very disruptive. So having somebody that talks the same language and that understands that daily routine is huge. Also, many patients, when they come here, they come as with a lot of fear, especially our Hispanic community, fears of prosecutions, etc. And so putting them at ease with, a familiar language is also very, very important. So from our side in our nephrology population, that also helps a lot to be able to deliver the right care. So I think that that's something that we continue to try to achieve. We try to attract physicians, nurses, and staffs that are able to speak their language. So,
Christina, could you share your perspective?
Sure. Just to piggyback on what Dr. Ruiz said, it is important to have representation. It's also important for institutions such as ours, in which we do it here at Cook County, is to deliver services in a culturally competent way, but also a cultural humility, through cultural humility, right? We can't be competent in every single culture as much as we want and try to be, but we can all be very humble. And that's really the culture that we are building here, that exists here. Here at Cook County Health, I think it's the complement of two, being culturally competent and culturally humble, and really at that bedside manner, talking to the patients, talking with them, not talking at them, to meet them where they are. Definitely, communicating with them in the language that they speak to feel more comfortable to open up and have that conversation about their health and their concerns and the health plan. But also being able to leverage and using the translation infrastructure that we have here in our system, especially as it pertains to Latino patients. We don't have a 100% bilingual workforce, and that's okay. But we are certainly improving that to have that diverse representation. But we do have the infrastructure. Here at Cook County Health, we are seeing a lot of the new arrival patients that are coming into the city. And it's really, provided a lot of lessons learned, and really ensuring and making sure that the culture and the staffing are culturally aware and are culturally humble to different journeys. The Latino population is a diverse one. And Spanish, there are different dialects of Spanish. And so definitely having people who speak the language, is important, and we try our best, but leveraging the different tools that we have to really deliver that care. And so if we're humble, that translate. That's also a language, right? That translates to support that complement to the care that they're giving.
No, thank you. I think that's so important. And I think that that's a really good key takeaway in terms of the necessity to be humble. I want to shift a bit now and talk and sort of delve into the spaces, the specialty, the areas that you both work in separately, but as a part of the Cook County Health Family Service Lines. Dr. Ruiz, I'm going to start with you. In the Hispanic community, it's twice the Hispanic community is twice the incidence of kidney failure as white Americans. Can you talk about the work that your team is doing to care and prevent kidney failure in the Hispanic community?
Sure. So yeah, the Hispanic community, in terms of prevalence of requiring dialysis, there's a big disparity. So it's twice as likely to develop or get to the point of end-stage renal disease, meaning needing dialysis or transplant. And what we do here, we have a comprehensive kidney center, which is at Stroger, where we treat renal disease from the early stages to the late stages, uh, needing dialysis or transplant. So, in terms of prevention, we try to attract and educate our colleagues and for early referrals and be able to treat diseases like hypertension, diabetes, and create consciousness about the importance of catching these things early and treating them. It's a very, very difficult task because, again, Hispanics are also and minorities are at higher risk of developing obesity, diabetes, hypertension. So from that perspective, we're expanding our access to care. So we have a clinic at Providence, we have clinics in Blue Island, and but also from the other spectrum, which is when patients are needing dialysis. Now we have our peritoneal dialysis program, which is a home dialysis program. This we started it in 2020, but at that time COVID hit, and so we unfortunately lost a nurse. We had to start again in 2021, and since 2021, now we offer this option of dialysis for our patients. And we've treated about 38 patients so far. Actively, we have 25 patients in the 2 years that we've been running the program. And from those, half of them, or actually 15 patients, are Hispanic. So this option of dialysis is huge for patients because nationwide, the likelihood that you receive a home-based therapy is much less if you're a minority compared to white population. So the fact that we are being able to offer that to our patients, it's a big thing. Patients are able to do dialysis from home. They're able to continue to work. They only have to come and see us twice a month if things are going well. So we are continuing to expand that program, and we would like eventually to increase it even further to other offices that we open. So we're doing a lot from that instance, and as I'll probably mention later, we're also increasing the access to transplant, which is our ideal form of treatment for end-stage renal disease. So that's where we are at, and I think many of our patients are coming to us now. We're able to keep them in our system. Before, most of our dialysis patients that started dialysis, we had to send them to private dialysis units, and so we would not be able to continue to care for them. And patients do want to stay within our system and knowing their doctors that they've seen for a long time. So that's also a clear improvement and big benefit for our system as well. So I think that's probably it in a summary.
No, thank you. That's really, I think you really spoke in quite a bit of detail about it at a high level, the different layers that are involved with addressing the issue. I know that we've been joined by our CEO, Mr. Rocha, and I'm going to allow Christina, you to follow up on where we started with this from a clinical perspective before I turn it over to our CEO to share with us some of his thoughts related to what's going on and his leadership here at Cook County Health. But Christina, going to take a bit of a shift in terms of the area that I know that you have a lot of passion and commitment to, and that is women's health. Can you talk a bit about some of the initiatives that Cook County Health is working on or taking part in, especially as it relates to women's health during pregnancy and post delivery? Could you talk a bit about that for us?
Absolutely, one of my favorite topics. Thank you for asking. So just to share, happy to really share that, we have a very robust women's health and children's health service model here at County, not just clinical, but programmatic. The reputation of County is not really for women and children's care. However, that is drastically changing. And part of the work that I do here is really ensuring that we have the programs and the access. Quality is definitely here, but definitely the awareness of the program and access to robust women's health care. So women who want to get pregnant and or don't, right? So contraceptive care, well woman care. And then those women who, are pregnant, and we really deliver robust prenatal care. We do patient education on the importance of prenatal care, adhering to all of the visits culturally, amongst the Latino population. Those born in the U.S. understand the U.S. model. Those coming to us from other countries as of recent, you have a different healthcare system and a different healthcare model. So we do a lot of patient education to ensure just the understanding of preventative measures and why they have so many prenatal care visits and why they're important, and to kind of link to what Dr. Ruiz was saying, nutrition is a big part of it, right? So nutrition and their health prior to pregnancy and during pregnancy and after, of course, is a part of the patient education we do to ensure that they have a healthy pregnancy and mom and baby stay healthy afterwards. So part of the programming that I was speaking to that we have to complement the medical services is we have a HRSA Healthy Start program, which the goal for that is to reduce infant and maternal mortality, to support healthy pregnancies, healthy women before and after, and healthy babies, right? There's also a fatherhood component to support men's health, but also family health, father involvement, and whatever that looks like. We have WIC to support with nutrition for mom and baby, formula, and we also have another home visiting program. So we have two that partners patients with community health workers to link to resources, to provide education, to get them items that they might need, such as car seats, pack and plays, diapers, formula, things that, come up for those individuals that have a financial insecurity or unhoused. They have a housing insecurity. Or again, I mentioned earlier that we are doing a lot of care delivery services for new arrivals. And so, the social determinants of health that we're seeing in the assessments in terms of risks that might impact their health during pregnancy and thereafter, we're really responding to by having these programs in place. The home visiting programs, WIC, family planning, and a really strong relationship with the provider and the care team to just be that wraparound support to support healthy families.
Oh, very good. Thank you so much for sharing that. I am now going to bring our CEO into the conversation. Israel, both Christina and Dr. Ruiz have spent a little time talking about their specific areas or focus areas. We're wondering if you could share with our audience today, from a leadership perspective, what is the importance and role of cultural competency? We talked a bit about earlier about being culturally humble. What is the role from your perspective in that as it relates to delivering service? And if you wouldn't mind sort of weaving in, we'd love to hear from you a bit about, because I imagine, and knowing you as we do, that there's some connectivity about the importance of that and what led you into a career of healthcare.
Wonderful. Well, first, I want to start by wishing everybody a very happy Hispanic Heritage Month. This is an important celebration because one of the most important things that we as a healthcare system can do is to recognize people, to recognize who they are, and to be able to talk to them about healthcare in a way that connects, that understands, that sees a whole person. And so by celebrating Hispanic heritage in a healthcare setting, we're wanting to express to everyone that we see everyone for all of who they are. And we want to make sure that our spaces are feeling, they make patients feel at home, that they feel welcome and able to talk about what their healthcare goals are, what their health needs are, and how we can partner together to move forward into the future. And it's also an opportunity to recognize all the wonderful things that have been done by leaders of Hispanic background in healthcare. Most recently, I learned that the first full facial transplant was done by a surgeon at NYU who was of Hispanic descent. And there are leaders everywhere. And that's also important to celebrate because I've always been a believer that it's a lot easier to do it once you've seen it. And so all of us are leaders to our communities, to people who we may not even know are watching, just to show that it is possible to dream big, to aim for your positions where you want to be and how you want to get there, and that there are roads and leaders and individuals who have done there and are waiting for you to go even beyond everything they have accomplished. And so this is just a time to celebrate, especially populations that are underrepresented in fields of medicine. Just recently I learned that only about 7% of doctors in the United States are Hispanic, and we have much improvement to do in that area. So really, first and foremost, when I tell everyone, it's a great opportunity, a great time to celebrate each other, who we are, and to recognize everyone together. But I'm really excited about what we're doing at Cook County Health, which is we are making sure that our entire enterprise from end to end is welcoming to all patients of all backgrounds, all ethnicities, and all languages. We have really invested in our language service access. Technology is one of the things that we're very excited. It used to be where you had to work through phones and translation, and they didn't speak certain languages. Now we have in-person interpreters as well as virtual interpreters in almost 200 languages for individuals that come to our organization. We're making sure that we have advanced modalities of treatments for chronic conditions that we know affect all communities and are right now the largest reasons why people die prematurely in our country. While we all have many things that we battle with, like COVID, pandemic, and stress and other issues, we do know that the things that claims the most lives prematurely is cardiovascular disorders, neurological disorders, pulmonary disorders, diabetes, and those types of things that we actually have an ability to treat cost effectively today if we can get to everyone in time. And so we are also working across our organization to make sure that we get everyone in, that we are creating easier access points to welcome all patients into our health center, to make it easier to get an appointment, to make it easier to talk to a physician or a provider, and to make it easier to get your medications and treatments. And we're doing that utilizing technology, utilizing assistance, utilizing our great care team, and bringing in new individuals into our organization. Most recently, also, we have stood up our new asylum-seeking clinic that has done amazing work. It has seen over 15,000 patients. It is helping to keep not only our patients safe, our community safe, and make sure that as we're welcoming individuals, we're offering them an ability to make sure that they're healthy, they will keep themselves healthy and our community healthy. And so we're really excited to have been asked to partner in that endeavor. And then most recently, we also announced the Providence Scholarship Fund. That is a scholarship fund now that awards $1 million a year to individuals who come from underrepresented groups, Hispanics being one of those groups who are eligible to apply in medicine or nursing or any allied health profession, so that way we can ensure that there's a pipeline, that financial costs are not one of the things that prevent you from being able to achieve your dream. The scholarship is renewable, and it can start as early as your first degree in undergraduate every year, and it can continue all the way through your choice of graduate programs, whether that's to be an advanced nurse practitioner, to be a physician, to be a PA. We now are investing in your education so that you can come and be our partner in success. So I would say that right now at Cook County Health, it's an exciting time. It's an exciting time for everyone to join us, for everyone to be part of our Cook County Health family as a patient, as a care provider, as a supporter, as a community member. We welcome everyone to help build the most dynamic team we can to make amazing things happen in healthcare, to advance our health standing, and to hopefully once and for all help to narrow that bridge that we hear on the tale of two cities, that there's segments of the city that are largely filled by underrepresented and minority groups that die 20 years younger. Our goal is to erase that 20-year gap in life expectancy. And we're doing that by making sure that healthcare is accessible, available, and that we're bringing individuals of all backgrounds so that when patients come into our healthcare facilities, they can feel at home, they can feel heard, they can be seen, and they can be treated. And that's what we're excited about doing here today. And just want to celebrate everyone's Hispanic Heritage Month. And to all those who came before, we stand on your shoulders to build greater institutions tomorrow.
Thank you, sir. The audience can clearly see that we have not only passionate leadership, but we've got passionate frontline workers related to making certain that we are really delivering on the mission of the organization. I'm going to circle back to you, Dr. Ruiz. Can you talk a bit about, I know that partnership and collaboration is very important. Studies have shown that Hispanic patients often spend more time on the kidney transplant list and often have worse outcomes. I think you even spoke to it a bit earlier. Can you talk about really quickly the work you are doing to make sure patients get the care that they need?
Yes. Yeah, just like you said, I mean, Hispanic patients and in general, uninsured patients have a high rate or delay to get a kidney transplant. Sometimes they're not even offered a kidney transplant in the city. Most of the transplant centers would not even see you if you don't have commercial insurance. So when I came back in 2017, I started talking with a colleague, also a transplant surgeon at UIC, Dr. Almario, who with which we started talking, and he told me that they were able to start doing transplants on patients who were uninsured with the help of the Illinois Transplant Fund. So I said, well, that is the population that we have here. Many of our patients are not even eligible for basic insurance. And so we started informally finding a way to refer the patients and enrolling them in this Illinois Transplant Fund that progressed until we were able to do an agreement between our divisions, transplant surgery and nephrology, with the help of Dr. Hart and Dr. Benedetti from UIC. And we were able to start getting those patients in. Rules changed, and Medicaid is now covering transplant medications and other procedures. So from 2021, when we started that collaboration in March of 2021, we've referred 320 patients, which is something unheard of before. And of those, we've already done 26 transplants. We have 44 patients that are active on the transplant list, and we still have like 30 plus patients that are doing workup to see if they can get on the transplant list. So our goal is eventually to increase these numbers. We are working into setting up an actual transplant clinic that would be a collaboration with UIC or the University of Illinois, so that we could have those patients seen in real time and not have to be transferred and have to switch their records, but just actually see them here, continue to do most of the workups that we usually have done at UIC, do it here within our system. So we're working really hard to get that transplant clinic here so that eventually things get much faster, done much faster. Unfortunately, a big number of the patients that we have referred, those 300 patients, about 20-30% are not being able to be contacted because, you know, many of our patients, they're afraid of answering the phone from somebody they don't know. So some of them are difficult to, you know, arrange for care. But then when they come to see us here and having them come to their own clinic, that I'm sure is going to increase our numbers for transplant. And that's our main goal. I mean, if we are able to transplant patients before they go into dialysis, that is a huge survival benefit for them. The earlier we get them transplanted, the better for them. And even for the system, it's way cheaper to treat transplant patients than be paying for dialysis for a long time. So we're very excited because, of course, up to 30% or more of those patients are Hispanic, but majority are, African Americans, Hispanic, and from other. But the key is that we are seeing a big jump in the numbers of patients that are transplanted, which before, again, it was unheard of. Most of the times, if you were Hispanic undocumented, the chances you were pretty much told that you were not going to get a transplant. And actually, the first preemptive transplant that we had was a Hispanic patient that was told he couldn't get a transplant because of his pretty much his situation, social situation. Went to Mexico, tried to get a transplant, came back, and then I met him and we helped him and we got him in and he got a preemptive kidney transplant. That was the first one we did. So it's very, very rewarding, and we hope that continues to be the trend and we can sign this agreement and start a kidney transplant clinic here.
Thank you so much. That's also such a great personal story. And again, partnership, collaboration, a huge part of what we see in our role here in delivering quality, equitable care. I'm going to turn it back over to Israel and Christina because you both mentioned the work that we're doing as an organization with new arrivals. Can you talk a bit more or share a bit more for our audience the details about where and how Cook County Health has been engaged and is engaging with this very critical work?
I'm going to get started, then I know Christina has a lot of the details and works very closely with the program. So from the very beginning that we started to get the arrivals coming via buses from Texas, Cook County Health has been working with the city of Chicago to be able to create a sort of a intake clinic that really helps to provide some of those essential services to individuals who will be here and who are arriving into our community. So far, we have cared for almost about 15,000 patients, and we have provided about 58,000 visits across the system. The services that we provide everything from complete physical examinations to testing and lab services for key conditions like HIV, STIs, TB, and other risk factors that individuals want to get tested for. It also gives vaccinations, COVID-19 testing, gives assistance with any kind of preschool physical screenings, mental health support, and any critical medications that people may need to be able to stabilize any chronic conditions and ensure that they're safe. And of course, if there is an advanced, immediate, urgent, acute care need, we're able to meet those needs through our specialty network as well as our hospital network at Stroger and Providence. And so we have been happy to work in partnership with the city of Chicago and have had the full support of course, our Cook County President Toni Preckwinkle, as well as our board of directors, to be assisting in this endeavor. And we're very happy to have been able to help the individuals and to help the city and the county as a healthcare responder.
Christina, can you share some thoughts as well?
Sure. Thank you, Mr. Rocha. Covered the majority of it at a very high level. There's a lot of day-to-day heart and elbow work that goes into supporting the needs of the new arrivals in partnership with hospitals, CBOs, FQHCs, health departments. Part of the work that I do with the new arrivals is working with our CCH operational team after the intake, right? So they come to us for initial intake. And so a lot of these individuals need ongoing care. So, the pregnant women, the children, specialty visits. And so I have a team of care coordination. It's a mix of clinical and non-clinical that work with the city of Chicago and in those areas where they're being housed to ensure that there's coordination of care, ensuring that there's no care gaps, making sure that we are really looking at the elements of population health to really serve, making sure that our communities stay healthy, that these individuals have access and equitable access to care and equitable access to care in the language and in institutions that lead with humility and cultural competency. It's been my pleasure working with this humanitarian crisis and ensuring that the city of Chicago is definitely delivering for this new arrival patient population to ensure that they have a healthy foundation to really lead healthier lives right beyond their medical situation.
Yeah, it's such a great example of the rich legacy and history of the organization. We are going to do a really quick rapid roundup here. I'm going to ask each of you to give a really quick sort of gut response, if you will, to this final question. And I also want to thank you all so much for all of the work that you do here at the organization, both from my leader and from my colleagues. It's just an honor to work side by side with all of you. So very quickly, final question. You all are in different areas of the healthcare field, and you've all spoken about what brought you to this space. Can you discuss why representation is so important and critical in the work that we do? And Dr. Ruiz, we're going to go in this order. We'll start with you. Christina, if you can share a quick insights, and then we'll bring it back to our CEO. So Dr. Ruiz, why is representation so important?
Well, I think it's a way in which we tell our patients, and especially in our system, that we recognize their value in our communities, that we acknowledge all the work that they're doing for the country, and that we see them just like Mr. Rocha was saying. And it is a way in which we show our respect, and that way that is going to improve our outcomes for as a society in general, and in our healthcare system. That is vital. So it is also a way in which we show the folks that we need for them to come and work for us, that work with us, that this is a welcoming environment. Yes, I mean, I think that it would be very enriching if we increase representation so that we can achieve those goals. So I'm sure many of our patients really value when they're able to speak with medical staff or nursing or anybody from any level of work here, when they speak their own language and they see a welcoming face. So I think that I'm happy that this is something that the system is striving for. So hopefully this can continue to improve.
Thank you, Dr. Ruiz. Christina?
Yeah, that's a great question. Thank you. I could think of a lot of things, but I'll keep it to, this is Hispanic Heritage Month. We're celebrating our rich culture, a very diverse culture, but we also live in a very diverse city and work in a very diverse organization and do a lot of training on diversity, equity, inclusion. But I think representation really matters because also part of diversity, equity, inclusion is that the B, right, for belonging. And so when you're represented, it helps people feel like they belong. They feel like they're a part of it. It helps them feel like they're a part of it, along with just, the compassion and the humility that, we treat individuals with. But it just really helps people feel like they belong as, part of the population, part of the community, part of whatever space that they're in. And so I think that's, to me, right now, that's why representation matters. It helps people feel like they belong.
Thank you, Christina. Our CEO?
Thank you, and definitely agree with what Dr. Ruiz said and what Christina said about the programs. But I want for a minute to just think about what the experience is like. Imagine that you're someone who is not feeling well, and you go into a clinic room or into a hospital, and you're about to see your provider, and you're trying to get help. And that individual is speaking a language that you don't understand. And then you're now grappling with trying to communicate your pain and your feelings and the sensations that are occurring to your body in a way that is trying to bridge languages or access. Or more important, we know that every day medicine is advancing in such a rapid pace in a beautiful way to solve diseases that before we used to think were never going to be addressed. But every input and every ability of every point of information that we can get helps us be that much more successful. And so you have a provider who has a wealth of knowledge, who can help treat illnesses, who wants to help the patient, but needs those details to be able to get the best care plan in place for them. And you have a patient who's struggling to communicate what they want to. And that doesn't always have to be a language. At other times, it can be that they walk in and they're not asked the right questions, or they're not put at ease to be made feel at home. And so their answers are very short and basic and necessary, but not giving you the true context of what you need to treat the patient and their illness. So I would say the ability of what we can do as a provider is to understand each other, to have representation on the doctor's side, the nurse's side, the patient's side, from all backgrounds and information. So when we're creating that interaction between patient and provider or patient and nurse, they can communicate in the most strongest way possible to get the information across to one another, so we can bring all the wonders of medicine to bear on that patient. And that starts with there being an understanding at both the physician, provider, clinic level, hospital level, patient level. And the more that we have community and bridging and representation on all sides of that equation, the better we're going to be able to advance healthcare for everyone. Because what we have learned at COVID, and we have, of course, we learned difficult lessons through that process. One of those lessons that we learned is that healthcare is universal. What affects you affects us. Viruses and bacteria don't recognize borders. They don't recognize languages. They recognize people, and they recognize how they communicate with each other. And we saw in COVID-19 that communication can be strong. If our communication is not equally as powerful in return, we make ourselves vulnerable for everyone. So through better representation, better access, we can heal better, we can treat better, and we can protect better.
Thank you so much. What an amazing note to end on. And while it does bring today's conversation to an end, we want our audience to know that we are here always, and that there is no end to the level of our commitment to provide service to the community. So I want to thank you all again so much for joining us here today, as we here at Cook County proudly celebrate Hispanic Heritage Month, honoring the amazing contributions of generations of the community who have enriched our nation. I'd like to thank our panelists for their time today and for joining us in this discussion. As always, we want to close with a reminder that at Cook County Health, we have proudly served generations of families and patients, regardless of their ability to pay, their immigration status, or their insurance. Your health has a home at Cook County Health. And if you or someone you know needs healthcare services, I urge you to call, take out a pen, 312-864-0200 to make an appointment. You can also Google us, you can search us, Bing us, whatever you need to do. We are in the community, we are here to serve, and we want to thank you for joining us today.
Thank you.
Thank you all.
Thank you so much.
Thank
Thanks
you
for
so
the
much.
invitation.